Welcome. Today, I am excited to have Melissa Wood. Hi, Melissa.
Hi, Leanne. Thank you.
Yeah, Melissa is an end of life doula and patient advocate. Her company, Peaceful End of Life, focuses on providing patient advocacy and compassionate guidance towards a peaceful end of life. Before her work as a doula, she spent the last 25 years in naturopathic medicine and massage, helping people to live a healthier life naturally. So thank you, Melissa, for being with us today. Is there anything that you wanted to add to your introduction?
Not at this time. Just wanted to express appreciation for being invited to be on this summit. I'm excited to be here and to share this information.
Absolutely, it's so important. Okay, so let's just start with just tell us, what is an end of life doula?
So, an end of life doula, actually, people have been doing this for thousands of years. We just didn't really have a title for it. It is something that the term end of life doula or death doula has been coming on the scene more recently in the last probably 5 to 10 years.
Hmm.
But people know of birth doulas, right? Women have been helping other women to have births for thousands of years, and we've been doing the same thing as people are approaching the end and the transition of their life.
Right.
So we provide spiritual, emotional, practical support for the patient that is starting to transition and their family and their friends, whoever needs that support. And sometimes we do it when they're not actively dying. Sometimes, we have conversations with people that are just curious about death. They want to understand more about what to expect. They have questions. Their family's afraid to talk about it and they don't know who to talk to. And they don't necessarily have to be dying to need an end of life doula. Most of our work involves end of life patients, but not all.
Okay, very interesting. So is that kind of the difference between an end of life doula and, say, hospice?
Yes, and there's several main differences. Hospice is wonderful. I think everybody's going to probably agree that hospice is something that is amazing. We want to have that medical support with us at the end of our life, particularly if there are some physical complications, most notably pain. And so the main difference between what hospice does and what a doula does is that hospice is going to provide that medical support. They're going to have physicians, they're going to have nurses, they're going to be able to prescribe medications, specifically pain medications most of the time, and administer those medications, where a doula is not going to do any of those things. We are not medical. We are not typically physicians. We're not typically nurses, although sometimes nurses transition into this. If they've worked in hospice for a long time, they'll become a doula. But most of the time, doulas do not do anything related to medical. We're going to be the emotional support. We're going to be the ones that are there at 2 o'clock in the morning holding that person's hand, not typically hospice. In the period of time that the patient gets diagnosed with a terminal illness and they bring hospice on, most of the time you might see that hospice nurse once a week. In the active stages of dying, when that person's actively trying to die, they can come more frequently. They're on call 24 hours a day. Certainly, you can always get somebody from hospice. But they're not going to be doing the 14-hour vigils like what I've done with patients. We're holding their hand all night, being with them when they're scared, answering questions if they're conscious, talking with them, making sure that they're comfortable. Hospice is not going to do that. So we're going to be more hands-on, more in tune with them, more in communication with their family most oftentimes, and we'll be a great liaison between what we see happening with the patient, because typically we're there a lot more, and then we can convey that back to hospice and let them know about changes. So the medical piece is really the big piece, and the time piece. Hospice is never going to be able to spend as much time with that person like a doula will.
Gotcha. Right. So when you, as a new mom, and I have a doula, if I had a doula at a birth, that would be really focused on me. And so is it the same when you're dying, that the doula is really focused on the person that's dying, or is it kind of shared between family or friends?
It depends on the situation. I had a doula client last year that the patient was dying. I actually never spoke with her. I never saw her. I was never involved with her care. She was a nurse. She was well aware of what was going on with her and very comfortable with the fact that she was going to be transitioning. Her whole family, on the other hand, was not. So I had Zoom meetings with the family who were scattered all over the United States and who really wanted some assistance in, how do we best support her and what do we do if this happens and what is going to happen and, all those kind of questions. So in that case, I never even had anything to do with the patient. It was all about the family. That's probably typically not the case. Most of the time it's all about the patient
Right.
and it's probably a lot to do with the family as well, especially as the patient might start to decline more. If they become unconscious, the family's going to be getting more of that attention because they are here and they're going to have a lot of questions. What's going on? What can we do, or is there anything to do, or what do we expect next? So sometimes that attention is going to shift from the patient over to the family when the patient becomes unresponsive.
Right. Yeah, for sure. Interesting. I just a friend of mine's grandparent just died, and she's in Colorado. The family's in California, and I can really see where having the kind of a coordinator or a go-to or somebody, kind of, I don't know, like a glue to kind of hold things together for people might be really nice, especially in this time of more virtual, the more virtual life that we have going on
Yeah,
right now. Very
yeah.
interesting. So,
COVID has
go ahead.
COVID has made this a little more challenging because we can't often do face-to-face visits. So fortunately, we do have these platforms like Zoom. Thank heavens that we can get on a phone call and see somebody face to face and visit with them and try to calm fears and answer questions and things like that. So Zoom has been it's not the same as sitting at the bed holding somebody's hand, but in a case like that, when the family has questions and they need somebody there to help them, sometimes it's just a Zoom call away, you know.
So, have you ever, as a when you're actually with the patient themselves, have any of them ever asked you what is it like to die?
Not really. I can't say that anybody has had those conversations with me. That doesn't mean they haven't had that conversation already with their doctor.
Yeah.
But my last patient that I had, she was pretty clear on what to expect. She did not have a lot of fear or concerns. Her fear and concerns were around staying here and having the quality of life that she had, and in her opinion wasn't a quality of life at all. So she was quite ready and quite clear on the fact that she didn't want to stay here any longer, and she was not afraid. So everybody's going to be different, certainly in cases where an illness is suddenly sprung on someone. Oh, you've got 6 months and you didn't even know that you were sick in the first place. Those are going to be different because they are going to be upset, angry. They're going to go through the myriad of emotions, and then that's probably going to be the time when they're going to say, what is it like to die. I personally haven't had any of those kind of cases yet.
Okay, interesting. Um, yeah, I think that being able, when you are going to die, being able to have that peace and that comfort is such a huge gift to yourself and to your family and friends, just to not make it worse for
it,
anybody.
it is, and that is unfortunately where the resistance comes in, especially here in the States, around talking about death, having those conversations with your family. I mean, I've had it happen in my family. My father refused to even acknowledge that, he was going to die someday. And so consequently, there were no conversations that were had at all. And this was a long time ago. So Now, I part of my role is to educate people and encourage them to have conversations with their families, because the resistance of the diagnosis and the resistance of the fact that, yes, honestly, we're all going to die. Nobody's going to get out of this life alive. We're all going to die someday. There is no such thing as cure in my world, because eventually something's going to happen that we are going to pass away.
Mhm.
And fighting that as hard as some people fight it, to the point where they are willing to do really last ditch, what I call Hail Mary treatments from the medical community. Oh, we're just going to throw everything at it, every drug, every surgery, everything possible, without considering the quality of the life after we do those things. And if they don't work, what the quality of life is going to be. That whole fight makes things much more difficult on the patient, and certainly on the family that have to kind of hang in there while they're going through some of these treatments that in many cases the treatment's worse than the problem to begin with. That, if they would just accept that, yes, this is what you've got, and enjoy the last 3, 4, 5, 6 months of your life without trying every, not so great treatment out there that can be, harmful and take away a quality of life. And everybody has to make those choices. I mean, I'm a cancer survivor. I made that decision long ago when I had cancer. So everybody's going to do those choices the way they need to, but they need to kind of educate themselves about, nobody ever asks the questions, well, how sick am I going to get? And how is this going to affect the end of my life? And what pain am I going to end up with? Whereas maybe if I chose a different route, I may not have had such a challenge.
Sure. Yeah, I'm very familiar with that for sure. So you said that it's important to talk about death and dying before we get to that point. And that's one of the reasons I wanted to do this series, was because that's exactly what I think too. So what are the conversations that we should have?
Well, the first, probably most important thing is, and medical is starting to do this now. Hospitals are starting to do this. Physicians are, just making sure that people have paperwork in line. The advanced directives that are clear about, what do you want to have happen if you become incapacitated. And I'll give you an example. I'll use my own family as an example here. My father, who had Alzheimer's disease, and I was 24 at the time when this happened,
Mhm.
had Alzheimer's disease and had a little stroke, and went to the hospital. And because of the stroke and because of his advanced age, he was significantly older. He was 60 when I was born, so he was much, much older. He lost the swallowing reflex in his throat, so he was no longer able to swallow food. And the surgeons came to me, the physicians in the hospital came to me and said, look, he's not going to be able to eat, and we need to put a stomach tube in. And so, of course, I said, well, sure, you need to do that. Today, I would make a different decision, because all it did was prolong the Alzheimer's state for another 6 years, where he had no quality of life. He couldn't eat real food. He didn't know who I was. He didn't know who anybody else was. So that's the kind of thing where you just need to look at that and go, do we make those choices, now? But if your family knows what your wishes are, like, he never would have wanted that, but we never talked about it. So and at the time I didn't know. I was young. I had no idea, but we never discussed it as a family. And so the communication between the family and the patient, or anybody and their doctor, and making sure that their paperwork spells out exactly what their wishes are, that's part of how this gets done, and people can have the death that they want, as long as they're clear about it in the paperwork. And there's games that, there's card games you can buy that, believe it or not, center around death, that families can play, that bring up these topics to talk about. And it goes back, way back to that communication, and to make sure that everybody knows what you want.
Yeah.
And
Interesting.
then there yeah, and then there's things like death cafes where people can go and talk about death in a safe environment where everybody can, talk about their fears, ask questions. Usually there's people there that have some knowledge about the topic, and that death cafes are another way that people can talk about death.
Right. Right. Yeah. And I wanted to ask you about that. Let me just back up a little bit. You talked about medical directives, but and that's more of like if I'm in a coma, I don't want to stay in a coma, or if I need a feeding tube, I don't want a feeding tube. But then that's not a DNR. That's not the do not resuscitate orders that people
No.
sometimes have.
No, it's not. It can be. I mean, again, each person's medical situation is going to be different and whatever illness that they're dealing with. So, I mean, I've had patients do the advanced directives and complete a DNR at the same time.
Okay.
Certainly, to go into hospice, you pretty much have to have a DNR. They are not going to do any extraordinary measures to save your life if you stop breathing or start to have a heart attack or something. They recognize that you are at the end of your life and no extraordinary measures are going to be taken. But, in this land of COVID, with so many unknowns and so many people in their 30s and 40s dying, not everybody's in their 80s. Lots of young folks are dying. Advanced directives are needed at any age, every age. People should be looking at that and making sure that, gee, I've never really thought about, what would happen if I was in, if I had COVID and I was in the hospital and they wanted to put me on a ventilator and maybe I won't ever come off of that. Do I even want to go down that road?
Right.
Those are the kind of questions. And the advanced directives help, but doulas can help. Doctors can help answer some of those questions. But it's something that everybody should think about because even if you're 30 or 40, I know it's common for 20s and 30-year-olds to think out, I'll think about death some other time. I'm not even close. Well, there's a bus around the corner, right? We just don't know what's going to happen in our life.
Yeah, exactly. A car accident or,
Yeah.
anything like that. So,
Yep.
yeah. So then, all right. So I saw on your website and you mentioned death cafes. So are those virtual? Are they actually like people actually go places to meet? And what do you talk about in a death cafe?
So, because of COVID, I can't speak for other death cafes, but I can say here in San Antonio, our death cafe has chosen to go virtual.
Mhm.
But before COVID, we met at a coffee shop, and everybody ordered food and a coffee, and we would just sit there and talk about death and dying. Typically, in our case, it we ended up having quite a few of the same people, but new people would come and grandmother got diagnosed and now my family's thrust in this death thing and I found out about death cafes and does anybody have any advice, that kind of that person. Death cafes are not bereavement groups, so they're not for people that have just lost loved ones, that are grieving, that need support. There's plenty of grief and bereavement groups out there. Death cafes are more for people that are curious about death and dying and they want to ask questions. And so sometimes people will bring in articles. Medical aid in dying is something that is really common. Lots of articles are being published about that because more and more states are approving it. So sometimes that'll be a topic of conversation. Hospice conversations will come up. It really just depends on the day. And I know for us, we've had a lot of COVID conversations the last couple of months because, we can't see each other anymore. So, and many of us have lost people in our families, in our friendship circles to COVID. So we talk about it.
Right. And
So
it's both people who may be involved with a loved one who's dying, or people themselves that maybe have gotten a diagnosis and want to move forward.
In our death cafe, I don't know that we've had anybody that is actively dying be part of our death cafe.
Okay.
But that doesn't mean they all don't. This is a nationwide, organization. You can go to deathcafe.com, I think it is, or deathcafe.org, and search to see if there's any death cafes in your area. I think they're in all the states, if I'm not mistaken, certainly major metropolitan areas. And again, now that so many of us are doing the Zoom thing, I join in on a death cafe in North Carolina. So, they've been kind enough to let me in. So I know that anybody could find a group to join,
Interesting.
even if they're not in that city.
Yeah. Interesting. All right. That's a really good information. I did not know about death cafes. So,
Yeah, they're
um,
great.
so you also talked about as a doula supporting people emotionally. The physical, the medical part is really more hospice, but you help people more with the emotional and the spiritual aspects.
If
So what's
they
that like?
want the spiritual support, if they do want it, I'm not a priest or, a reverend or anything like that. And if that person has tended to be more spiritual in their life and less, quote, religious, they don't belong to a church congregation, they don't have a specific religious group, then that does involve spiritual conversations, sometimes, and sometimes not. It just, again, every person is going to approach this time in their life differently. Um, it just really depends on what their individual needs are. If they wanted, a Catholic involvement because they've been Catholic, then, clearly their church is going to be involved. There's people that are going to be coming. The priest will come, and as doulas, we're there to support them whatever they need, whatever they want. It isn't me to say, well, you must do this spiritually or you must do that from a religious perspective. Doulas do not do that. We are there to listen and to be there with them as their support system, to let them, if they need to rant and rave because they're angry about what's happened to them, then, we're here to take that on. Where sometimes family can't take that on. They just can't handle the fact that their person's dying and that their person's mad. So it's a different role. And yep, sometimes it involves spirituality and religion, and sometimes it doesn't.
I can see where that's would be so valuable. Um, if somebody has something that they want to say, want to get off their chest before they die, and they don't want to burden their family with it, or if it's about somebody in their family or something, they don't want to talk about it. But just, I mean, whenever so much of the time when we go through a life crisis, having somebody to listen to us is so valuable. And I don't want to say that death is a crisis, but it is definitely a major part of our life. And I can see having somebody just there to listen and to be a part of that, how valuable that would be.
It is, and for some people, it is a crisis. When they don't want to face the fact that they are dying, and they certainly don't want to burden their family with it. Oftentimes, it will be the spouse. Especially if they've been married a long time. It's hard for them to talk to the spouse about the fact that they're dying when the spouse is not at all on board with the fact that they're dying. They need somebody to talk with, and so that's what we can do to help that person. And again, it doesn't necessarily mean that they're in hospice yet at this point. It could just be a conversation that they have well in advance, but that they recognize that the end will be coming. It may not be for a year or two, but they still want to talk about it. And so a doula can be there to help them with just listening, letting them vent, letting them talk, and feeling safe to do it, and not feeling the burden of what that does to their children or their spouse or their parents, or whoever that those important people are in their life.
Right, right. So if people talk to you, well ahead of their actual death, we have like a lot of times we'll have a birth plan. Do people have a death plan?
Well, in my opinion, they should. I always like to talk about the fact that, for humans, we plan everything major in our life, right? So if we're going to have a baby, sometimes that baby's planned for, but sometimes it isn't. But certainly the birth of that baby is planned for. We have baby showers and baby this and that. And we plan retirement parties and birthday parties. And sometimes we spend years planning vacations. You can't plan a wedding in a day. You can't plan a death in a day either. I mean, it is something that deserves the time and attention to it, just like every other thing in our life. because it's a very important, it's just as important as our birth, if
Yeah,
not more so, because it is at the end of our life. We want it to be as good as we can have it. We don't want to have a bad death. And that means planning. That means, preparing sometimes years in advance to make sure we're making the right choices in our life, and having our lifestyle be good. And so everything we do every day has an impact on the kind of death that we're going to have.
right. Interesting. Um, let's see. Yeah, you had said that you felt we were missing being present for our death, and that's something we want to avoid doing that. And so I can see where that puts us. That makes us having a plan, talking about it ahead of time. Um, we can be more present to our
Yeah.
death. And what else did you mean by that?
Well, just that, again, going back to that resistance. And again, I'll use a family member that I had that really did not want to even discuss the fact that he was dying, and wanted to continually try treatment after treatment after treatment, and because I'm in the natural health world, herb after herb and nutrition after nutrition and just different things, without ever stopping to say, okay, I'm approaching, I'm certain age, and I'm approaching the end of my life, and I need to maybe recognize that this is happening. And do I have any unfinished business? Is there anybody I want to talk to? Do I want to make amends? Do I want to make a phone call? Do I want to talk about things that maybe I shouldn't, I have regrets about? And who do I want with me at the end? And all those kind of things that are important to consider. You miss it when you are focused on curing and getting through it, and going, I'm not going to have this cancer anymore, kind of thing. And so that was his experience, and that there wasn't anything anybody could do to talk him out of that. But unfortunately, it left part of the family out of the picture, and it was hard. And it's being present is so important to be aware of what's going on, so that you can make those phone calls, make that amends, say those apologies, give somebody forgiveness, whatever that is for you. um you want to do that, and that's kind of being aware, being present for it. It's a different time of life, and some people journal extensively. There's a lot that happens.
Mhm. And I wonder if people worry or think like, well, if I plan for my death, if I get all my affairs in order, so to speak, or, and make the phone calls that I need to make, and then kind of like get ready to die, if they're then going to die. But I would think that if you could do all of that, then you can really put that behind you and then really live fully.
Yes. Yes. I had a lady that did that. She although she didn't really have a diagnosis from a doctor, she really felt like the end was coming. I think at the time she was 94, and she had planned everything. She had the will done and all the papers and everything done. She said goodbye to all her kids and all her grandchildren, and we had conversations about, well, I really feel like, within a month I'm probably gonna, check out. It's like, okay. So she got everything done. And then, of course, a month came and went, and 6 months came and went. Now it's been like 6 years or something. She's still here. And at some point, she had to go and look and go, well, okay, I guess this isn't going to happen. And now what? Now what can I do? And so the last 6 years have been so enriching for her. She's taken up painting, she's gotten a more spiritual life, she's happier, she doesn't have any rift with anybody in her family because she cleaned all that up when she thought that she was dying. So, it if we all would just embrace, and I say embrace, and it's a hard word, but embrace the fact that we are all dying every single day. We're getting a little closer, and if you would just kind of get on board with that philosophy, it makes right now way more important. It's like, gosh, do I really want to stay at this job that, they don't appreciate me and I'm underpaid? And do I really want to stay in this marriage? and I'm not doing my dream job, or I'm not traveling, or I'm not, whatever those things are for that person, they're not doing them. And if you get the diagnosis, you've got 6 months, well, you can still do it, but it's kind of too late when you've had the whole life to be able to do those things that you really want to do. And so that kind of goes back to your question about, how do we just get on board with it and live a richer life now. um it will make the end better. You won't have all the regrets.
Yeah, all piled up at the end. And so, I mean, I was going to ask you if you had any advice or tips for living a full life, and I think that was it. You just covered that. Just like let's live our full lives now.
Yeah. And the other part of that is what I used to tell all my naturopathic clients. So for the last 20-25 years, I've been counseling people on overcoming illness using natural medicine and nutrition. And so what I used to tell people is, once you get diagnosed with that chronic illness, let's say you get diagnosed with diabetes, or, chronic pain, fibromyalgia, kidney disease, there's cancer, there's a lot of chronic conditions. Once that diagnosis happens, you need to really think about what is, even if you know that you've got a long time before you're going to pass away, you still have a life expectancy of 10 years, 20 years. You still need to kind of think about, what do you want your death to look like then?
Yeah.
Because if you've got a chronic illness, there are things you can do today that your lifestyle can change that chronic illness. You don't have to, frequently people would come in my office, especially 40 and 50 and 60-year-olds, with bags of prescription medications, many of which come from the side effects that one of the other ones gave you. So now, you're on 10 or 12 different drugs. And a lot of that is lifestyle. Our chronic illnesses in our world, especially in the United States, are 100% related to lifestyle and diet and nutrition, and smoking and not smoking and drinking too much, and all those kind of things. There's genetics in there, of course, but so much we have control over that we don't think we have control over, and we do.
Right.
And working on that can make the end much better. And again, that goes back to the living a better life now, making those changes now, so that when we get to the end, it's not so hard, it's not so traumatic on our bodies, on our mind, on our families, on everything.
Right. Yeah. 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 Such good advice for sure. I mean, yeah, life is now.
Life is now, for
Life is
sure.
now. Awesome. This has been just spectacular. Is there anything else that we need to cover that we didn't cover yet that you were
I don't think
hoping?
so. I mean, I just want to encourage everybody that, we're living in a strange time, especially with COVID. And there is a lot of fear out there, especially here in the States, with we've had so many people die. And there still is a lot of misinformation about, to vaccinate, to not vaccinate. And that's a whole nother topic. We won't go there. But, people are afraid. People are out of work. People are concerned. People are scared. And just so, when it comes to death and dying, just bringing to the attention of everyone to let them know that there's somebody like a doula out there that can help them and answer questions and maybe alleviate some of those fears. I mean, I've had phone calls with people that have been very anxious, very nervous, and I've walked them through a meditation on the phone, on the Zoom, to help them and given them tools so that whenever this comes up for them, they have the tools and resources that they can do to help themselves.
Right.
And that really is what it's all about. It's not about, alcoholism and, drinking a bottle of wine every day because you're worried about getting COVID. And, we're all away from other humans right now for the most part, which is hard when we're human beings and we like being around other people. So I guess I would encourage everybody not to be afraid. and just to know that there's help out here. And there's a wide range of death doulas, end of life doulas. You can Google us, we're everywhere. And if we're not where you are, most of us do phone calls and, my, and do Zooms. So, the help is there for people if they're concerned. And the best thing they can do is to educate themselves so that they're not afraid, and then that helps you live a richer life right now.
That's wonderful. Really good advice. And I can just see so many people like all of a sudden, like, I might die. Oh my God, like I could die.
Yes.
I'm having no idea where to go, who to talk to about it. You try to talk to your family and they're like, we don't want to talk to you about this.
Yep. That's right. Nobody wants to talk about it.
Find a doula. Awesome. Awesome. So, find a doula. How can people find you? And then, did you have a free gift to offer for people today?
I do. So my website is peacefulendoflife.com,
Okay.
and I've got a lot of articles out there. I've got a resources page. There's a contact form, of course, so somebody can reach out to me through my website and tell me they saw me on your summit, and I'm more than happy to have a 30-minute phone call with somebody or a Zoom call just to answer questions. Maybe you've got a family member that's dying, maybe you're in the process of starting to go through a transition and you want to know if a doula can help you or your family, or you just want to have a conversation about death and dying. I'm flexible. I'm any of that I'm up for. I'm here to help calm the crazy, as I call it. Our brain kind of gets a little bit upset thinking about death and dying. So, it doesn't have to be scary. There's lots of wonderful books out there that have been written about people that have had near death experiences and how they are far from being awful and traumatic and scary. So there's a lot of things that I can help people with, and I hope they reach out because I'd love to have those conversations, and I'm happy to offer that consult.
Wonderful. Thank you. And I will encourage everybody to reach out to Melissa, or find the Death Cafe, or
Yeah.
you know live a full life and don't be afraid of this. And that's very generous of you to be willing to talk to people, and also thank you for doing what you do.
Yeah.
That is just huge, and it has truly been a pleasure to have a conversation with you today. And please keep doing the work that you're doing to transform the world. It's so needed.
Well, thank you so much, and thanks for doing the summit because it is needed. And I know you're going to highlight a lot of my colleagues, and it's just kind of getting the word out on this topic, and it's needed. And so, thank you for all the work you're doing, and thanks for having me participate. I appreciate it.
Absolutely. Thank you.
Thank you.